Um, I guess what is it today? It's February, right? It's February.
It's February.
Happy February, Groundhog's Day and Valentine's Day. What else is there?
Oh my
Is
God.
there President's Day? Nay, what else is there?
It's Black History Month.
Black History Month. President's Day.
Got some vacation time coming up. Kids are off from school.
Yeah.
Winter break.
So, had a great conversation with a patient yesterday, and I think it's worth talking about. And she's getting older, and so her oral hygiene routine at home and her interval of cleanings have been set for a long time. What she does at home and how she could take care of her teeth here. But we had a conversation with her that, you know, 'cause some things are popping up, some things are changing in her mouth. Her health is becoming less stable in her mouth, and she was surprised. And her statement was like, I do this and I do that, and I haven't changed anything. And I mean, the point of the story was that, well, although you're not changing what you're doing, your body is
Your body's changing.
Yeah, and you know, my reply to her was, well, you're the oldest, and so am I. We are the oldest we've ever been at this moment right now. So there's a few things that come along with that. Your immune system, as you age, decreases, and with that, the amount of saliva that you have and the quality of the saliva decreases, which means that bacteria is more opportunistic. The opportunity can be more opportunistic and infiltrate areas that are susceptible.
I had a very similar situation with my last patient in hygiene yesterday.
Okay.
She's on 3-month recalls,
Mm-hmm.
taking x-rays accordingly. She came in yesterday. She had decay under 5 of her crowns.
Whoa. Well, the thing Jessica had the post-it.
They're all posted, not under the crowns, on the tooth surface,
Yeah.
next to the crowns.
Yeah.
And she's on top of a home cam, and
Right.
it's her dry mouth that she complained about. Same thing.
Medication may have changed. Her immune
Medication's
system.
changed. She's on Floridex toothpaste.
Wow.
She's doing it all.
Wow. Well, so, you know, our position as taking care of people is that we don't want you to get into a position where you think what you're doing is good enough always, in all areas of your life. It's a global conversation, and I think it's good to check in with yourself and your doctors and ask the question, what else can I be doing? Is there anything else I can do? Because the other part of it is that techniques and materials change as time goes on. We just started incorporating probiotics into our office. They've been on our radar for a couple of years. We're now doing it globally on every hygiene patient. So that's something we didn't have five years ago necessarily. It existed, but it wasn't as common practice. And now we know that it's a true and tried thing that we can do to help to maximize someone's oral health.
Our support team, our front desk, have been, if you notice, have been updating a lot of medical histories.
Yeah.
You know, a lot of these medical histories are out of date. And the hygienists are asking the right questions also, with medications and so forth.
Yeah, we as a practice are doing the same thing, right? We're not looking at what we do every day, week and month, and just keep doing it over and over again. We're questioning what we do. And so we're making sure that we're looking at your medication, what you're taking, how it impacts your oral health. We're looking at your oral health and seeing how it impacts your systemic health and trying to work together with you, especially given wherever you are in your life and trying to think about what we can implement. So
we're not just drilling and filling.
Yeah,
right?
yeah.
That's what we get known as.
Right. So think about where you are and think about where you're going in what age you're at, what decade you're in your life, and the things that you have to combat with that, and maybe adapting what you're doing from an oral health, but also systemic health, right? Are you lifting weights?
Sure. So let me ask you.
Is there another question? Another question.
Are you wearing a mouth guard at home at night?
Yeah. No, I do not right now.
Your Invisalign trays that you were wearing, how are you cleaning those trays?
Okay, so you want to think about the material, what you're cleaning at home, is it absorbable or non? So Invisalign tray, retainers, and most mouth guards that we make are non-absorbable. If they're rubbery, if they're rubber at all, they may absorb things.
Meaning the water, the bacteria is not going to get embedded into the tray.
It is harder, right? It'll get on the surface, but not embedded. Where the rubbery trays, there's some mouth guards that have a rubber inside.
lining on the inside.
And we do that for patients who have a lot of dental implants because there's no flexibility in their teeth, so they need some flexibility to get it on and off. So if your appliance is non-rubbery, that doesn't mean non-flexible because Invisalign is flexible.
They're all flexible.
Rubber means actually rubber inside of it. You can clean it with a lot of different things. Over-the-counter denture cleaners. They make retainer cleaners now, and powders and tablets that you can soak it in occasionally. We like to have our patients on a regular basis, daily, use a denture brush, which we have in the practice, with some soap, dish soap,
and water.
a little bit of dish soap, very small amount, and that's going to clean it.
And it's non-abrasive. The soap's going to be non-abrasive.
For what most people, what's your
Even if
patients?
you do, a lot of people take toothpaste to it,
Yeah.
and you take an abrasive toothpaste, it's going to scratch the plastic, and the bacteria is going to stick to it more readily. You know, if you're brushing and flossing before you go to bed, there's really not that much bacteria sitting in the tray. There shouldn't be any food in there.
Right, so
Right? If you're not snacking at night, and you're cleaning it in the morning, there really shouldn't be much.
And those tablets do a really great job. The tablets do a great job. You could not use a tablet. You could use one cup of water with a teaspoon to tablespoon of bleach and let it soak in it. That'll kill anything that's on there, including molds.
Yeah, patients would come to us and seeing little videos on TikTok, little mini ultrasonics to clean them in, which are great. It's just like a little mechanism. It could be battery operated or electric plugged into the wall, and the appliance are placed in there with a solution. Could just be water, and the vibration is going to clean the inside of the tray, of the hard tray, not the rubber trays.
As long as it doesn't get too hot.
Yeah, the hot water, if the solution is too hot, it will distort the material.
Simple enough. Like you said, simple is better than complicated. You don't have to do a bunch of different things. Another question that we had was around the ever popular talking point of oil pulling. A few patients were asking about it last week in the practice. A couple people were talking about oil pulling. And so we think of oil pulling as an extra thing that you can do if you're
not
interested.
A substitute for your normal hygiene program.
And that's like you could almost wrap it up there.
Yeah, I have no experience with it personally.
Well, I played around with, we've received a handful of samples of different type of oil pulling oils. I played around with them. Some of them are quite tough to use. Some are okay. The literature is inconsistent around oil pulling. You can find a few things that support it. Most do not. So we feel about it, if it's something you are interested in incorporating, sure, do it. Make sure you still floss, water pick, brush your teeth, do everything that you normally do, and layer it on top. Good. I guess the last thing we'll talk about today, and it's amazing we still talk about it, but
different types of toothbrush. It's like we hit this every second.
We talked about toothbrushes so much. Maybe how orthopedics feel about sneakers, maybe, I don't know.
Yeah.
What shoe should I run in? Okay, toothbrushes. There are 3 types of toothbrushes. There are manual, which are the regular standard toothbrush. There are battery operated that you have to change the batteries in, and then there's battery operated that are rechargeable.
So both electric.
Very
different variations of electric. And it's usually a different price point on the electric toothbrushes.
So we're okay with the manual toothbrush.
We're okay with all of them. If they're all done properly, they're going to work.
Yeah.
The manual, the cheap electric one that you can get for $20 in the supermarket, it's going to work. It's not going to have all the bells and whistles, and the bristles are shaped different on the better Sonicares and the Oral-Bs, which I personally think is going to do a better job. Basically, you want to stay away from a hard toothbrush. I'm not so sure if these disposable electric toothbrushes are hard bristles or not. I know the Sonicare and the Oral-B, which we usually recommend, have soft heads on them.
Right. So what they're saying, the cheaper electric, like what's that brand that's very popular? Quip, or Quip is a very popular brand. Or the manual toothbrushes, that's one category that fits into the same in terms of the execution of how you have to use it as a patient. You are doing the work. So with the manual or the cheaper electric, you have to be very attentive to your brushing for how long you're doing it and how effective you're doing it. You're doing the work, and the toothbrush, if it's a cheaper electric, like the Quip or something else, is mostly kind of vibrating and maybe has a timer in it.
Well,
outside of that, there's not much good literature.
I think there's some over-the-counter crest brushes that like have a spinning oscillating head on them.
Yeah, the spin brush. My kids play with those.
Spin brush.
As my kids use them, I have 2 very small children, and we kind of use them because it's like a toy, but it gets them to brush with it. Yeah. But we make sure they still brush as if it was a non-electric toothbrush. The other category are the true electric toothbrushes that are rechargeable, like Mark said, and that would be our 2 favorites are either the Oral-B IO, which is a fantastic brush. I would steer patients away from it who have some recession. It's a little bit of an aggressive brush. So for patients who have recession or like a more sensitive toothbrush, a Sonicare.
You know,
So I use a Sonicare. My wife uses the Oral-B.
I'm a Sonicare user also.
Yeah.
So the difference between the two, an Oral-B is going to have a small round head, almost like
Yeah.
a trophy cup that the hygienist cleans your teeth with. It's only going to touch one tooth at a time. The Sonicare, the head of that, is similar to a manual toothbrush. It's going to touch 2 or 3 teeth at a time. And you don't need to be scrubbing up and down. The brush is going to do the work for you. You're just going to rest it at a 45-degree angle on the tooth and let the oscillating effect of the brush do the work.
I received an email this morning from a patient asking me about a toothbrush, a brand that I haven't heard about before, an electric toothbrush that looks like a variation of a Sonicare. And there's a bunch of these out in the market. And I guess the issue with these startup companies are trying to move into a space, I guess, at a lower price point than a Sonicare. The nice part around Sonicare is they do have a full line of toothbrushes that are quite price competitive, even some cheaper ones that are $40, $50. Where Oral-B, the IO brand, is a little more elevated in the price. But the benefit of the Sonicare and Oral-B, and we have no affiliation with these companies, is that they've been around forever.
Yeah.
In a sense of it, and they do a lot of market research, a lot of research of what's holding up, what's not doing well. They do clinical research to see what's actually working. Where the startup companies, I'm just not sure how much they have behind them.
Yeah, I haven't seen any comparisons comparing the two brushes. There are some though that look very similar. There's some copies of Sonicare, and
I've tried a handful of them, and I see no reason to deviate from Sonicare or Oral-B. I just don't see the benefit.
The price point is not that much different. The brush is going to last you a long time. No matter which electric brush you use, you'll have to change the head. The heads are disposable. 2 to 3 months out of a head, depending if you're using it twice a day. I think you recommend.
Do you think how much a new iPhone costs, or an iPhone versus a toothbrush? And I know you're using the phone for a lot of different things, but people seem they get sensitive about the cost of a toothbrush. It's like there might be places to invest in yourself.
Yeah, I think a manual brush these days is like $4 or $5. I don't know.
I could use a manual brush in forever. You know, I'll sample at the hotel whenever I go. They give you a manual brush at some hotels, or we're
Did you use the one from the plane?
and I know that one. I don't like that one.
I didn't use it.
It's a wooden handle. I don't like wooden handle toothbrushes. The texture bothers me.
Oh, the handle itself. You don't like that wooden hand.
No.
Handle.
I don't like wooden spoons. I don't like wooden handles. Freaks me out.
Wow. Are you okay with chopsticks?
They're
Plastic or wood?
No, either, but they're smooth texture. It's different. Not you can't feel the grain of the wood.
Sure. Oh, I got it.
All right.
I don't like to clean a wooden utensil either, right? You can't use it, and it's going to absorb the mouth guard.
A spoon for yourself. All right. Any questions you guys have, please let us know when you're in the office, or email us, text us. Please, we try to make sure that we're attending to things that you're actually interested in or care about. Have a great month. Celebrate something. Celebrate life.
Have a happy Valentine's Day.
All right.